Story 1. I used to be a 280-pound bodybuilder, and since being diagnosed last summer, a mere 6 months ago, I've lost most of my muscle mass. Amyotrophic lateral sclerosis is a nefarious disease. 0 out of 10 would not recommend. Story 2. Starting strength training. It wasn't just about getting fit, but seeing how much stronger I could get each week was wild. Plus, the mental boost from feeling like I could actually lift heavy things was a game changer. Story 3. Alcohol. Lost my body and sense of self in the last year. 1 week without a drink and working on getting myself back. My best advice: stay away from the booze. Story 4. Eating disorder recovery. I have an eating disorder and was in the throes of it from age 11 to 18. I began my recovery at 95 pounds at 18 years old. My lowest was 83 pounds at 17 years old. My nails were brittle and breaking, same with my hair. I bruised at a poke and was winded walking between 2 classrooms. I cried at every meal. During my recovery and now my remission, I have managed to maintain a healthy weight of 130 pounds for about a year now. I'm 23. I have gone through phases of accidentally putting on too much, losing some that I probably shouldn't have, falling in love with food in the gym, and learning my body anew. I still struggle some days, but my body thanks me for putting in the work. I now have strong, healthy fingernails, long, shiny hair, and can run a 15-minute mile, and getting better. I only cry at mealtimes about once a week now. Mostly, my organs are no longer struggling to keep me alive. Story 5. Unfortunately, I had 2 strokes in one day at a pretty young age. I learned how to walk, talk, and move my right arm again. My feeling did come back in my right arm, but not all the way. I am still working on it though. I will never give up. Story 6. Menopause. As a woman, even after having 3 kids, nothing has been as crazy as menopause. It's like all the craziness of adolescence going on in your aging body without any of the benefits. Story 7. A stroke at 28 years old. That totally changed me. Then heart surgery the next month. Those were hard times and involved learning many things over. I still deal with the side effects of it daily. Story 8. Sporting 3 times a week. Went from the fat fumbling fool to feeling like I'm worth something. Also setting an alarm to wake up. Gave me rhythm and better sleep. Reducing my hours in video games from 8 to 12 hours a day to below 4. Actually started to want to live again. Story 9. After 20 years of slow upward weight creep due to kids, a desk job, and life, I was borderline morbidly obese, and nothing I did to correct it had any impact. High-intensity personal training 3 times a week? Check. For 2 years. Stop drinking? Check. Start cooking every meal from scratch using high-quality ingredients? Check. Multiple fad diets/programs? Check. The closest I got to losing weight was eating nothing but potatoes for a month. I dropped 20 pounds, and it came right back when I started to add in more diversity. Enter tirzepatide. My doctor prescribed it, but my insurance refused to cover it, so I reluctantly went through an online compounding company and paid out of pocket. As I crept closer to 300 pounds, I decided to just do it. The first dose blew me away, not because I instantly lost a ton of weight, but because all of a sudden food cravings were gone. I had heard the phrase food noise before, but I didn't know what it meant until it just disappeared. The amazing thing was that if I wanted to, I could eat a full-sized meal. I had no problem leaving food on the plate and no urge to snack or finish the food my kids left uneaten. Since then, I have lost approximately 2 to 3 pounds per week and am almost down to 200 pounds. Currently at 87 pounds lost. I still go to the gym. I still eat right. I still drink a lot less. But it's the tirzepatide that's making the difference. I can see myself again. And around the 40 to 50 pound mark, I stopped snoring too, so now I am not wearing my continuous positive airway pressure machine. I am aiming for 190 pounds, and then I will begin the taper process and am interested to see how maintenance works. But for now, I am very, very happy. I don't have any significant side effects, other than pretty intense fatigue the day after each dose, which I call the tirzepatides. Frankly, if this is just something I will need to take long-term, I am okay with it because my body looks, feels, and performs so much better. Story 10. Spraining my ankle in 7th grade. I had an air splint, which caused my ankle to sit oddly in my shoe, so it turned inward. I had gotten foot cramps in the next few years, and being young, thought nothing of it. My arch flattened, I got slower gradually, and my left leg turned just a few degrees inward, while my right hip and leg turned slightly outward. Both legs experienced overcompensating and atrophying muscles. My upper body skewed itself as well to rebalance, and I lifted weights for the next 2 decades, which exacerbated the imbalances and made most of my back and legs hypertonic, so I had chronic tension and stiffness that I either pushed through or didn't consciously recognize. I found some relief in yoga but limited progress and did it weekly for about a decade. I learned about dystonia as a neurological condition and how trauma can affect your brain's wiring. I attended a motion clinic at Mayo Clinic supervised by a neurologist and have used a few medications for the past 6 years along with spine and neck-focused physical therapy for the past 4 years. This was in addition to mental therapy, as I had family trauma in the years shortly after the ankle injury. Overall, I've smoothed and evened out, seeing day-to-day changes with my efforts, and I seem very close to normal. I'm able to walk long distances, do squats, or perform other exercises or movements that require multiple muscles working together without unusual firing sequences. I'm not a senior citizen yet, but it's not terribly far off. It's slowly sinking in that most of my life has had low to mid-level physical and emotional tension throughout and has limited my life in ways I may never fully comprehend. Story 11. My ability to binge eat died very quickly. My main piece of advice is that if you believe something to be your medicine, treat it like one. I had entirely positive experiences with psilocybin until I decided to take an irresponsibly high dose. Psychosis is real. Don't be a fool. If you are responsible, I can't recommend it enough. There isn't a lot of research due to legality, but the research that does exist is overwhelmingly positive, and word of mouth is similar. Story 12. Drinking. As I got into my 30s, I went from always being pretty thin and fit to tired, sluggish, and gaining weight more easily, with it being hard to lose. I've since quit drinking like I used to in my younger years, and the weight is basically falling off me now. Story 13. Crohn's disease. It's not something you would know by looking at me, but I have an ileostomy bag. My large intestine, rectum, and anus have been surgically removed. You get used to it, but sometimes I do look at my scars with a bit of sadness. I can also look at my scars with compassion. Story 14. Depression and eventually olanzapine. I had finally started to take control and work on my weight. I had gotten myself down from 280 to 250 over the summer, walking 5 miles a day during the week at work and a minimum of 5 miles a day on the weekends, cutting back to 2 small meals a day and a light snack after work. Then I had a severe depressive episode and ended up in the hospital. They diagnosed me with bipolar 2, put me on 3 new drugs, and sent me on my way. I ballooned up to 311 over the next 2 years. I just couldn't control my appetite. I was starving all the time. The food noise was just inescapable. It took 3 years to finally get seen by a psychiatrist, and she met with me once, started shaking her head, and said, "I really, in all honesty, do not think you are bipolar. The symptoms just do not match." We gradually began lowering my dose, and lo and behold, I had no negative reaction to the removal of the medication. On the recommendation of my current general practitioner, I'm now on semaglutide. It's been 2 months, and I've gone from 311 to 286. The food noise is gone. I still have cravings. I want Korean fried chicken so bad. But it's not like I have to have this food. I'm eating small portion sizes, occasionally only once a day. But I do have to load up on vitamins and supplements to combat the side effects I've been having. So there are goods and bads, but it's been a blessing so far. And I'm looking forward to the day I can shop for clothes at a normal person store and actually work out without getting winded after 10 minutes. Story 15. Getting diagnosed with attention deficit hyperactivity disorder and medicated at 38. Aside from the mental benefits of finally knowing what was going on, stimulant medications are appetite suppressants, and with them, my brain was finally running on a normal amount of dopamine. I no longer had constant sugar and dairy cravings to try and chase that dopamine. Lost 20 kilograms, 44 pounds, in 6 months, and another 20 kilograms in the next 18. Story 16, stress. When I was 9, I had to move to a different country, learn their language, and also learn English, which I didn't know. My parents forced me to do many other things. I was put into situations I didn't want to be in, learn things I didn't really want to, and it was also expected of me to perform perfectly in every subject. The constant crying and wiping my eyes made my eyelids very droopy and red all my life. The constant stress made my hair gray in some places. Exams and tests were very tough. I was expected to do all these things and do them constantly, to the point where I just lost my mind. At my breaking point, I became an artist. I'm older now, and I paint and go to an art university. I'm in my early 20s and already have 15 art exhibits. A calm life is all I ever wanted, and I finally have some semblance of that. Story 17, chronic illness. I had a severe adverse cardiac reaction to the COVID-19 booster in 2021. I was in pretty decent condition at the time, did a lot of hiking, ate healthy, and my only medical problems were that I was getting a painful cyst here and there on my ovary. Fast forward to that December, 2 days after the vaccine, I was bedridden and terrified. I was admitted to the cardiac ward of the hospital with symptoms of myopericarditis. I had a total of 15 visits to the emergency room during that time. It was the most terrifying experience of my life. Bed rest for 6 months, in a wheelchair for a year. I slowly worked back up to walking again. It has been 3 years, and I just now started exercising at the gym after receiving the green light from my cardiologist. I have to be extremely careful about triggering old symptoms. If I overdo it even a little bit, I'm back in bed for a few weeks. I have gained 100 pounds since my illness. I have a new perspective on life and an inherent distrust in healthcare and doctors. I do think the whole experience has made me a more tolerant, more accepting, calmer person. It didn't just fundamentally change the way my body worked. It changed me. I used to hate the idea of being overweight. Now I'm just content to be healthy enough to walk. Story 18, water polo and cycling. I started playing water polo my sophomore year of high school as a somewhat chubby football player. I lost over 40 pounds in a couple of months and have remained lean for the following 25 years by cycling 8 to 10 hours a week. I still remember the amazement of eating almost unlimited amounts of food but still losing weight when I was swimming 8,000 yards and doing dry land workouts 5 days a week. Story 19. My coach booked me in for a Muay Thai fight. Nothing like the fear of stripping to shorts in a busy arena and having to fight someone. I trained hard and ate like a saint. Fear of the event meant I never skipped a beat. Won the fight. Dropped mostly fat and never looked back. Story 20. Grief. Losing someone close to you obviously has significant mental consequences, but it manifests in the body too. Weight loss, weight gain, stiffness. The book, The Body Keeps the Score, explains more. Story 21. Cancer, cancer treatments, and the side effects of cancer treatments post-remission. I am technically in worse health now at 33 than when I was going through radiation therapy in high school at 17. Story 22. Stress is eating me alive right now. Job hunting, dying family, bills, money, politics. I feel like Spider-Man holding that train from going off the rails, except his outcome was better than how mine is looking. Story 23. Trauma and antipsychotics. Finally got my life together and claimed my body back over this last year. Back to my baseline weight and trying to get even healthier. Story 24. Undiagnosed Hashimoto's thyroiditis. My thyroid was being attacked by my immune system and it wasn't able to do its job anymore. I was so cold, tired, and weak all the time. My skin, mouth, and eyes were always dry, and my hair started to fall out. I have a lot of hair, so it was only noticeable in the shower. I kept falling asleep everywhere, in meetings, while driving, etc. Things are still different while medicated. I can't really handle high-impact exercise, and I have to eat regularly. I could go a couple of days without eating and not really notice before. Now I start to feel weak and shaky. I always have to monitor my symptoms and energy level because my body is still attacking my thyroid. The medication is just supplemental thyroid hormone, and that dose has to be increased every time my thyroid fails a little more. Story 25. Chronic physical and mental illnesses. I constantly have to remind myself and those around me that although I may look like a fully normal and able-bodied 27-year-old, I am not. Story 26. Getting infected with COVID-19 3 years ago. Yes, I had been vaccinated prior to catching it. I'm among the lucky ones who won the long COVID lottery. It disrupted my body's autonomic system. Story 27. COVID. Now I have had long COVID for almost 4 years. I lost my muscles in my job, had to drop out of college, and move across the country to live with my parents again. Story 28. Caught COVID-19 late 2022. I'm 30 years old and weigh 150 pounds. My 65-year-old, 270-pound dad is in better shape than me. The man just did a 27-mile bike trip while I'm over here giving my coworker the give me a minute gesture because I am so winded and dizzy from the walk from my car to my desk that I am unable to speak. I've gone from weight training 3 times a week and daily 3-mile walks to being unable to do my own laundry because I can't manage to carry the basket downstairs without seeing stars. It's honestly terrifying how quickly my entire life changed and how dependent on others I am now. I don't know what I'm going to do as I get older or what type of quality of life I'll have as all the normal age-related issues kick in.